Yes, 101.1 FM and AM 1160. Oh, we knew him as that curly-haired kid from Northern Cambria when he was here. He is Dr. Joseph Rocco, joining us on the line this morning from Bethesda, Maryland. Joe, good morning.
Good morning. Good to be on here.
It's good to have you with us here today. We've got so much to talk about with you. You are one of the fellows at the National Institute of Allergy and Infectious Diseases, working on Dr. Fauci's team with the COVID-19 pandemic. I assume that has taken up the majority of your time for more than just the last 6 months.
Yeah, so I would say technically, I guess I'm in one of the labs. Yeah, I work in one of the labs at the National Institute of Allergy and Infectious Disease, which is the lab of immunoregulation, would be the technical name, I guess, which is the lab that Dr. Fauci started. And you are exactly right. Just about everything, probably not just here, but really all over the world, has shifted fairly dramatically and rapidly to the study of COVID-19 at this point in time.
You're a second-year fellow, right? When you first got there, was this on the radar at all?
No, not at all. The first year, it's a 2-year, fellowship, and then most people stay on and continue their research after those 2 years. And the first year is all sort of clinical, taking care of patients, and then from there it's mostly research, but patient-centered research. And this was a complete blindside for, I think, just about everyone in the world. And it really, around March time, changed just about everything to every aspect of training.
So when you think back to that time in March, when the big change came, not only for you but all across America, I'm sure the changes were pretty big, but very much a pressure-filled environment for you in your position. Is that correct?
Because we're still on the front lines, taking care of patients, and as the cases start to not even just increase, just appear in this area, you're taking care of them in the hospital and seeing them, and it's certainly it was sort of an eerie type of thing. You heard about this, there was rumbles since January, and when it finally gets here and you're seeing the patients with the disease, it certainly makes your heart race a little bit, and just the unknowns, which there's still so many of them, but the unknowns at the time is just amazing. And we're having discussions about how to manage people and care for people, and so many of the answers to what do we do next is, well, we don't know.
Yeah.
So it was certainly a pretty pressure-filled and really extraordinary time, that is for sure.
So the research was changing every day. The information that you had as a physician, that was changing every day. And I'm sure if you had Joe Rocco's knowledge that he possesses here on September 29th, and you could speak to that Joe Rocco back in March, you'd have a lot to say to that guy, wouldn't you?
Absolutely. And I'd have a lot to say to a lot of people to try and spread the word. But it is really extraordinary. There's two extraordinary points. How far we've come in such a short period of time is really quite extraordinary, and how far we still have to go is probably and unfortunately the more extraordinary thing. But just the concentration of resources to figuring out everything we can about this disease is across the entire world is really quite remarkable. And it was amazing to experience it and live it firsthand.
Putting that puzzle together, I'm sure there were points when you were going down one road and all of a sudden you said, let's make a complete U-turn, or let's veer off to the left or to the right here. Were there great changes in the way that you approached the whole puzzle?
Yeah, I think there definitely were, and sort of in two different arms, in the transmission arm, which, we're still trying to define, but the most remarkable one was the patient care arm, where at first, we don't know what works or if anything works, and people are sort of, throwing the kitchen sink, at these patients, unfortunately, and trying to figure out what works best. And there's some things that I think a lot of people thought would work, drugs that we tried and later found out they didn't. And then there's a lot of things like the biggest one, probably steroids, the dexamethasone you may have heard in the news, which I think most people thought would not work based on experiences with other respiratory viruses. And now that one actually, at this point in time, seems to be probably the most reliable treatment. So really big U-turns in both directions along the way.
Are those the sorts of things that you notice right away with the patient? All of a sudden you change the treatment and boom, this seems to work much, much better than what they had been doing before?
You know, and this is the hardest part about this disease process, is because you don't notice it on that effect, on that sort of acute effects. And it's because this is, you know, the number of people that get seriously ill from this is quite high as far as respiratory viruses are concerned, but is quite low, you know, and, you know, it's 10 to 15%, which is remarkably high overall. But, you know, to see that severe disease over time, you know, a lot of the patients you see are asymptomatic or with mild symptoms, and you just kind of watch and hope in the acute setting. And a lot of times they get better and you don't have to do anything. And if you really, a lot of it's timing. You got to catch them right when they're getting worse to start the treatment. And, you know, you got to see a lot of them to really notice that it works. So it actually was not something that, you know, was that obvious. And I think that's why, you know, across the whole world, you know, there was so many controversies about what actually works. But I think now that we have some of the studies and some of the data, we can say quite confidently, you know, this was a very well-designed study, and this clearly shows a benefit, and we all feel very comfortable continuing with this going forward.
I'm sure that there have been times when this was unfolding before you and you were watching this, and how quickly this became a wildfire all across America, that you said to yourself, I'd just like to be dribbling a ball at the KCAC or up the floor at Northern Cambria, anything to escape this for a moment or two. You have those sorts of flashbacks from time to time?
Oh, absolutely. Yeah. Just, you know, if I could roll into the gym at 7 a.m. rather than into the hospital and just, you know, get a couple thousand jump shots up, you know, or even go to one of Coach Lombardi's, you know, legendary / infamous, you know, 3-hour practices or so, that would have been a welcome relief, I think, at many points during this whole affair.
You know, it's interesting you say that, because I was at a practice earlier this year, just for a brief moment, watching how he conducts those things and the sorts of disciplines that he instills in the players, and the way that he says to them, okay, here's the situation, this is what's going on, think this through, and tell me what you would do, and then go out and execute. That sort of critical thinking, does that help you in what you're doing now? I
think absolutely, unequivocally, you know, my time at IUP and on the basketball team there is one of the most influential things, I think, that has helped me be successful in this career. Just the aspects, the communication, the teamwork, the humility, you know, the sort of need to make decisions in, you know, acute, you know, settings when you really don't, you know, you don't have much time to think it through. I'm really thankful for that experience all the time, and I think it absolutely has been extremely beneficial to me, you know, outside of the basketball world.
Yeah, absolutely. You think about how sports prepare you for the world, and it really is fascinating to me. So here we are at this point where we're talking about vaccines and when they might become available. We're talking about treatment and therapeutics. For you, over the course of the last 6 months, it's been quite the experience. Where do you see this happening over the next month to 2 or 3 months?
Oh, man. If I knew that answer, I'd probably be in very high demand right now, because I think, you know, at this point in time, anything is on the table. But I think there is, you know, a lot of reasons to have hope, because, you know, we have, you know, just now compared to then, we are a lot better at treating this infection. And, you know, when people get really severely sick from it, there's not just one thing, but several things that we could do. And many of them we know work now, which is just a huge relief. And the even more reassuring thing is we got a lot of things in the pipeline. The vaccines obviously being, you know, the big the big gold star, and hopefully those results from those 3 big trials will be coming out soon. I have no clue when, but I feel like we've been saying soon for a long time, and they will be here at some point in time. And the other reassuring thing is, there's a lot more treatments in the pipeline too, and really, the NIH and the whole country has jumped on this from the beginning. Yeah. And there's a lot of things we've been working on, and a lot of those are going to, I think, reach the light of day here in the upcoming weeks and months, and we'll be even more prepared to handle new infections.
I'm sure that you have those meetings all the time talking about here comes flu season. It's going to combine with COVID-19 and complicate things even further. The preparation for the coming months on your part and your team's part just must be tremendous. Yeah,
and it's tremendous and, unnerving to an extent because, again, I think nothing would surprise us now, and anyone that thinks they could predict what happened has been humbled so far because we've realized that really anything can happen. So really, probably the old adage, prepare, hope for the best, and prepare for the worst. And I think everyone's making those preparations and taking it just one day at a time is all you can do.
Dr. Joe Rocco, I want to thank you for spending time with us here today. I sort of picture your dad watching basketball with that newspaper up in front of him because he just couldn't watch, and I can see him watching you at work now doing the exact same thing, just peeking out around it.
Yeah, absolutely, yeah.
I appreciate your time today. Can we call upon you once in a while? I won't bother you too much to come back up and update our listeners.
I'm always happy to talk to the Indiana area. I miss that area in IUP a lot. So nice to come visit and nice to talk to some old friends for sure.
Joe, thanks so much. Have a great day today.
You too. Take care.
It is the voice of Indiana County, WCCS 101.1 FM, AM 1160. AM 1160.